Good morning, my dear students. I am Dr. Mohamed Alnamoury, a lecturer for obstetrics and gynecology, and today I'll talk to you about premalignant and malignant conditions of the cervix. What are the premalignant lesions? Premalignant lesion in general means a lesion that will predispose or progress eventually into malignancy or cancer. To know what's meant by CIN or cervical intraepithelial neoplasia, first of all we have to know two definitions or two terms. First is dysplasia or dysplasia, which is abnormal growth and development of the cervical epithelium. In this condition, the normal epithelial cells in the cervix are changing or are on their way to become malignant. They are in a state between normal epithelium and malignant or cervical cancer. In this condition, we have some histological changes in the cells which can be seen under the microscopy. It's called dysplasia. Okay, usually discover this condition by the pap smear or cervical screening program. Cervical screening is an international program which is applied from 25 years old to 60 years old. From 25 years and every 3 years, every woman should undergo cervical swab, okay, by taking a smear or a swab from the cervical mucosa to be examined under the microscopy and checked for any dysplastic cells. Okay. Dysplasia can be grading into mild, moderate, severe. Type 1 cervical intraepithelial neoplasia, in which the dysplastic cells occupies the lower third of the stroma. Moderate or CIN2, in this condition, dysplastic cells occupy 2/3 of the thickness. Severe or CIN3, in this condition, the whole thickness is occupied by dysplastic cells. Again, dysplastic cells, not malignant cells. It's just cells which are abnormal under the microscopy. It has large nuclei, large nucleocytoplasmic ratio, dense chromatin, and these cells are considered dysplastic cells. Okay, if you find these dysplastic cells are occupying the lower third of the whole thickness of the epithelium, it's called CIN1. If they occupies 2/3, it's called CIN2. If the whole thickness is occupied by dysplastic cells, it's called CIN3. Okay, predisposing factors to premalignant conditions or CIN, cervical intraepithelial neoplasia, are the same predisposing factors to cancer cervix. The main factor is the infection, HPV, human papillomavirus type 16 and 18. This is the main factor and the main etiological factors for cancer cervix and for premalignant conditions or cervical intraepithelial neoplasia. And in many countries, during the routine screening for cervical cancer, they test the swab for HPV infection. And if the woman or the swab turns out to be positive for HPV infection, we need to send the woman to colposcopy. Second item, multiple partners, high-risk sexual partners, coitus at early age or early marriage, sexually transmitted diseases, smoking, immune deficiency, and multiparity. Again, all these factors are so important and so active, but the main factor, which is commonly found in about more than 90% of cancer cervix, is the HPV 16 and 18. Okay, to understand what happens in the cancer cervix and in the premalignant conditions, we need to understand what's meant by transformation zone. Transformation zone is the zone between the original squamocolumnar junction and the new squamocolumnar junction. Okay, this area includes area of metaplasia. Okay, when the HB virus attacks the cervical epithelial cells, the main vulnerable area to be attacked and to be transformed into a sinister or into a cancer is the transformation zone. Look at this image. You can see we have the columnar epithelium in red color. Okay, in the center we have the cervical canal. The red area is the columnar epithelium. The pink area is the squamous epithelium. And we have this dotted line discriminating between the area of original squamous epithelium and the area of metaplastic squamous epithelium. You know that in prepubertal area, the columnar epithelium occupies most of the cervical surface, and the area of metaplastic squamous epithelium originally in the prepubertal stage it was columnar epithelium. But under the hormonal changes of the puberty and after puberty, the columnar epithelium starts to change into squamous epithelium. The area of transformation at which the columnar epithelium were transformed into squamous epithelium is called area of metaplastic squamous epithelium. This is a transformation zone. And so again, transformation zone is the zone of metaplastic squamous epithelium. It was originally columnar epithelium, and during pubertal changes, it's transformed into squamous epithelium. Okay, this metaplastic area, this transformation zone, is the main area to be attacked by the HB virus or the early intercourse or multiple sexual partner, and the main target of all these pathogens to form the cervical dysplasia. This is real life. You can see the red area is the columnar epithelium, and the surrounding pink area is the transformation zone. Okay, to diagnose cervical intraepithelial neoplasia as a premalignant condition, first we need to do examination. Vaginal and adjacent organ are examined. Okay, then we need to take a pap smear by a spatula to obtain smear or sample of cells from the cervix and any abnormal areas by scratching and scraping gently from the cervix. These cells are fixed by alcohol and spread into a glass slide and sent to laboratory to be examined under microscopy. This is a technique of pap smear. You can see the speculum is opened until we got a clear visualization, the good view of the cervix, and then by inserting a wooden stick called a spatula, we can, or sometimes we use the brush, cervical brush, like the toothbrush, and then we take a swab by rotating the spatula or rotating the cervical brush or cytobrush to remove and obtain some cells from the cervix. Here is the spatula, the wooden spatula. In the second slide we can see the cervical brush or the cyto brush. And then we fix those cells on a glass slide and examine under the microscopy to look for any dysplastic cells in the cervical epithelium, as I mentioned, including large nuclei, multiple nuclei, increased nucleocytoplasmic ratio. If the woman got abnormal premalignant condition, moderate or severe dyskaryosis or dysplasia, or HPV positive swab, or we suspect that the woman may have a cancer. In all these conditions, we refer the woman to the colposcopy clinic. Okay, and so if the smear test is abnormal, patient may be referred for a colposcopy. Colposcopy is a small microscopy with a good light source. It magnifies the cervical image up to 40 times, and also we can take a sample called a biopsy from the cervical epithelium. Here is the colposcopy. You can see the pinnacular, the magnifying lens, okay, and you can look through the pinnacular to magnify the cervical epithelium, and we can apply some dyes like iodine dye or acetic acid to induce some changes in the epithelium, okay, and look for any abnormal uptake of these plastic cells. Okay, if you add acetic acid or vinegar, okay, the abnormal epithelium or the epithelial area with this plastic or CIN will be white in color. Okay, higher uptake of the acetic acid. On the other way around, if you add iodine or iodine, the dysplastic areas or the areas with CIN will not uptake the iodine because these cells don't have enough glycogen to uptake the iodine, and so they will be pale or uncolored on the colposcopy. And so on the colposcopy we can have a naked eye view. We can see through a color filter to visualize the blood vessels patterns and distinguish between normal blood vessels on the cervical surface and abnormal vascular pattern. Also we can add some dyes like iodine or acetic acid and look for changes which are abnormal if we have cervical intraepithelial neoplasia. How we manage CIN? Usually we are aiming to destruct the cells, either by cryotherapy, frozen with liquid nitrogen. We can use cold coagulation, hot probe on the cervix under local anesthesia, but the most commonly used technique is the electrodiathermy or electrosurgery by destructing the cervical intraepithelial neoplasia by applying heat to destroy and coagulate the dysplastic cells. This is cryotherapy using liquid nitrogen to freeze and destroy the cells. You can see the probe is connected to liquid nitrogen tube. Okay, as I mentioned, the most commonly used technique or procedure for destroying the cervical intraepithelial neoplasia is by using electrosurgery, which is called LEADS, large loop excision of transformation zone. LEADS, large loop excision of transformation zone. Here we remove the area of the cervix that contains the abnormal cells. Okay, we use a thin wire to cut through the affected area. Usually we start from the one right angle to the other right angle. Okay, and you remove a cone-shaped sample of cervical stroma, cervical tissue, and then examine for any dysplastic or cancer cells. Here we can see the loop or LEADS loop. Okay, and you can see it's moved from one right angle to the other right angle to remove circular wedge-shaped area of the cervical tissue. The other way to take a good sample or biopsy from the cervical tissue is by using knife cone biopsy, using a knife or a scalpel to remove a wedge-shaped sample from the cervix. The apex, as you can see, the apex of the wedge is towards inside, and the base of the which is outside. Okay, and so this is in brief how can we first what's meant by premalignant cervical condition, what's dyskaryosis or dysplasia, what are the predisposing factors for CIN, and remember very well HPV type 16 and 18. How can we diagnose the dysplasia, how can we screen and how can we diagnose dysplasia, and finally how could it be treated. Okay, thank you very much. I hope this brief lecture about premalignant condition is useful to you. Thank you very much.